A very big hello to all my dear students. So, welcome to the T2O series in your favorite channel, You and I. Let's see what we have in store today. So, which clinical case are we going to discuss? Let's read the question together. A 60 years female presents to the eye OPD with complaints of marked diminution of vision in her right eye with severe pain, there is redness and watering. She has undergone cataract surgery of the right eye 4 days back. On examination, the right eye, the visual acuity is 6 by 60. This is important. In contrast to the records of a visual acuity of 6 by 9 immediately after surgery, post-op. Okay. Now, the right eye is showing marked conjunctival congestion. There is chemosis. You all know chemosis is conjunctival edema, corneal haze, and hypopyon. That is pus cells in the anterior chamber. Right. What else? Pupils are showing relative afferent pupillary defect, and very important, fundus glow is absent. The other eye is normal, and yes, ultrasound B scan is showing vitreous exudates, right? So, what is the diagnosis? I think it's very simple. A patient post-operatively presenting initially with a better vision, suddenly the vision is deteriorating, there is redness, pain, photophobia, chemosis. The important is absent fundus glow, pupillary reactions are affected. And even in the USG-B scan, I see vitreous exudates. Of course, we are talking about endophthalmitis, right? So this is a case of endophthalmitis with hypopyon and congestion. Right. So the presentation, it's a very important topic. What next they ask you? What is the next question on this is, what is the most common etiological agent? So you know in the endophthalmitis can be immediate onset, that is early onset, as in this case it was after 4 days, or it could be late onset. In early onset, the most common cause, सबको याद है? Staph epidermidis. Late onset, you will answer propionobacterium acne. If that is not an option, the next best option will be fungal. Please remember this. Okay, once we know this, the next thing they ask you is about the treatment part. So we all know the choice of treatment is intravitreal antibiotic injections, right? So intravitreal, and if the vision is less than hand movement, we will go for pars plana vitrectomy. Otherwise, the treatment of choice you will answer is intravitreal antibiotic injections. Okay. Next thing they ask you which antibiotics you can give into the vitreous. So what can be given in the vitreous? It can be ceftazidime, vancomycin or dexamethasone. The next question is what antibiotics are contraindicated intravitreally? If this is asked, what is the answer? It is of course gentamicin and amikacin. Why gentamicin and amikacin are contraindicated? Because they are toxic to the macula. They are maculotoxic. And which are the antifungals? If it is a fungal endophthalmitis, you have to give an antifungal. Which antifungal is allowed intravitreally? That's another question. So, कौन सा आप intravitreally दे सकते हो? Antifungals that can be given intravitreally. Now you have to answer is, you will say amphotericin B. Okay? And second that you can answer here is amphotericin B, or you can talk about voriconazole. It is voriconazole. Right? So that was about endophthalmitis. And what did we just mention in the question? Ultrasound B scan. Let's have a look at that. Yes, so this is your, can you see this? These are the vitreous exudates as shown in that. Any vitreous exudation, and later it can lead to, of course, some pull at the retina and retinal detachment. Right. So that was about endophthalmitis. Please read it in detail. I hope you enjoyed the session, right? So thank you so much. Stay blessed and keep smiling.